PubMed is the free interface for Medline, the premier database for biomedical literature. Access PubMed from the library website or a research guide. On the main page of PubMed, I'll begin to search for information on my question. How can the risk of osteonecrosis be managed in a 60-year-old female patient taking bisphosphonates who needs to have a dental procedure? I've entered this search string in the search box at the top of PubMed's main page: osteoporosis or bone density and osteonecrosis or bone cancer or jaw diseases and bisphosphonates. I'll click the search button to the right of the search box to run my search. Here are my initial search results. There are more than I want to scroll through, but before looking at ways to limit my results, I'll show you what PubMed does behind the scenes for each search. Look for the Search Details box in the lower right portion of the screen. I'll click the See More link to find out exactly how PubMed has translated my search. PubMed automatically tries to map each word that I've entered to index terms, called medical subject headings in PubMed, and tagged as mesh. Remember that using the right index term will help you to search more efficiently. Think of this as the difference between using heart attack when you actually mean myocardial infarction. PubMed also does keyword searching for each word or phrase, tagged as all fields. You don't need to check search details each time you do a search, but if your results aren't what you expect, it's a good idea to do so to see if at least one word for each concept has mapped to a mesh term. If they haven't, rethink the words you've used in your search. Back on the search results page, I've decided that there are so many results that are off topic that I want to revise my search, adding the dental procedures concept to it. I'll add "and dental procedures" or dentistry. Here are my new search results, which are more focused on my question. To find the information I need, I should look for recent articles from the last 5 years on humans, not animals, and written in English that are practice guidelines. Filters found on the left side of the screen will help. Under publication dates, I'll select a 5-year range. You can also create a custom date range of any length. Under species, I'll click the Humans link to retrieve only research on humans. When I add a filter, a clear link appears on the right, so that I can easily delete it. I can also see the filters that I've applied at the top of my search results. These filters will stay active on all of my searches until I change them. To add a filter for English language, I'll use the Show Additional Filters link at the end of the list of filters. I'll select the type of filter, in this case, languages, and click the Show button to make languages appear in the list of filters. Then I'll click English to apply that filter. Practice guidelines, randomized control trials, and reviews are useful article types when you need to find the standard treatment for a disease or condition. I'll try practice guidelines first. So under article types, I'll use the Customize link to see an extensive list of options. I'll scroll down to find and select Practice Guideline. I'll click the Show button to make the filter appear on the list, and I'll add it to my search by clicking the filter name. Here are my search results. You won't often be able to focus your search this much. If we needed to use review and randomized control trials, these are what the search results would look like. But you can see that by using appropriate search terms and filters, you can come up with a more manageable set of references. I'll click an article title to read the article abstract, and check for electronic access using the Get It button in the upper right. If you have any questions about searching PubMed, please contact your informationist or the Taubman Health Sciences Library.